with the areas that they got treated, for sure, it's going to be a dramatic change. It's going to be a faster recovery. Usually, it takes on a normal person, healthy person, it takes, like 6 weeks for them.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Linda Judith Pena, a licensed physical therapist assistant and the founder of Body Sculpting Room, a wellness clinic she launched in 2022 in South Texas. Her expertise quickly attracted referrals from plastic surgeons for specialized post-surgery care. Certified in manual lymphatic drainage, a rare and in-demand training, she helps clients recovering from cosmetic surgery and breast cancer. As an aesthetic injector and entrepreneur, Linda is now expanding her clinic into the Dallas-Fort Worth area, bringing her unique blend of medical expertise and beauty innovation to a wider community. So Linda, welcome and glad to have you here.
Well, thank you for that amazing intro, David. Daniel.
Yeah, no problem. So Linda, I'm curious, how did you first get interested in medicine?
So I've been a physical therapist assistant for about 10 years now. When I came into physical therapy, I was working a lot in the hospital, in the ICU especially. And I started with working with patients that had cardiac surgeries, hip surgeries, and my job as a physical therapist assistant is, to get them to move, to exercise. That is like my biggest job is movement. So it was very difficult because these patients were a lot of the times in excruciating pain with, swelling. And the medical field, all they're used to is just giving medications and medications for pain or medications for swelling. But the medications, they get you so far and they cause other issues, other symptoms and side effects that, these patients are left suffering. So luckily, as a physical therapist assistant, we do have some lymphatic training and we take, additional courses for swelling. And I had taken the lymphatic course and I was able to come in and do some lymphatic on my patients in the hospital. And it was just amazing because I saw a night and day transformation with the movement of these patients from one day to the next. They were able to, to move their limbs and get up and walk. Their legs would be literally really thin and wrinkly from all the lymph fluid that left their bodies. So that was like a big aha moment for me because it was something that didn't incorporate medications and it was something holistic that it was just something simple like manually. And I wanted to share that with everyone and, like promote this technique that I feel like it's so underrated. And that's what drove me to, expand out of the medical field and into the aesthetic world.
Okay. Now, since this lymphatic drainage is something I want to dive deeper into. So lymphatic drainage, number one, what is it and what's the benefits of it?
So lymphatic drainage, people don't realize that we have two different, circulatory system. It's a circulatory system that circulates our blood, and then the lymphatic drainage is a completely different system. It's first line of defense. It creates all the antibodies and defense mechanisms that our body needs when we're having an infection or when we have an injury or when we're having, our body's going through some kind of cancer. Our lymphatic system is activated and it creates these little soldiers that go and, defend our body and get rid of all of those, all the waste. So our lymphatic system is underrated for the fact that, a lot of people don't prioritize, getting the lymphatic massages. It's just very important because when a person goes through difficult moments like cancer, and they have their lymph nodes removed, then they're struggling with long-term swelling and lymphedema
Mm.
for life. And it's something that they're always going to suffer with. And they need a specialist, lymphatic specialist, to help activate those lymph nodes and move and transport all that lymphatic fluid out of their body. Yeah, they're not common everywhere, these, therapists. They're very difficult to find. I didn't realize how rare they were until I, got further into it. But yeah, it's really important.
Okay, so with this lymphatic drainage, so I guess the lymph system is kind of like your immune system, or it's tied into the immune system. Is that, am I understanding that
Yeah,
correct?
yeah, correct. It's a huge part of the immune system. It creates all the cells that we need when it's, our body's under attack from infections or cancer cells. It's whenever we have a cold and you feel your, swelling on your neck, that's part of your lymphatic system kicking in.
Okay. So with this lymphatic drainage, is something that people would only seek that out and seek out this treatment for very specific situations, or is something that you can that's tied into wellness, we can just do it just to kind of improve your health and just improve your immune system? Like which one is it? Is it more like anyone can get it done, or is it really just going to be for certain situations?
Actually, it's both. Anyone can get it done. Anybody who's trying to get pregnant or anybody who has allergies or, just suffering with a lot of congestion, they can come and get it done for wellness. It boosts your immune system. It and increases your circulation. It decreases swelling. It gets rid of all the waste in your body. But on the other side, anybody who has gone through surgery, any kind of pretty much surgery, anytime you get a surgery, our lymphatic system is compromised because they're having to cut into your skin. So, especially for post-surgery, like plastic surgery patients, are the ones who are getting the lymphatic treatments. So, for me, what one thing I've noticed is there's a huge discrepancy with people who get surgery and they're not being recommended to go get a lymphatic massage. So they're left, healing poorly, with a lot of complications. One of my missions is that, closing that gap.
Got it. So when it comes to you mentioned massage as far as this lymphatic drainage. So when I think drainage, I'm almost thinking like you're trying to like flush out the system. So like you're injecting some type of liquid and you're trying to flush it out. You mentioned massage. So are there different ways that you're able to do this treatment? Like, is it only massage, or are there other ways that you can do this treatment of injecting something in? Like, how does that part work?
No, it's not injecting anything. It's all manual and it's just redirecting all the fluid that's sitting in your body, all that waste is redirecting it back into your lymph node. And then it's a technique, it's a manual technique, full body. And you activate all your those, those sites, the lymph sites, and you get your body to flush out everything and flush it back into your circulatory system, and your body just eliminates everything. So it's very relaxing. It's not painful at all. It's very relaxing, and it improves your GI system as well. If you're a person that suffers a lot with constipation or any of that, yeah.
Got it. Okay, so then, and as far as the treatments go, how many times you need to get this treatment? I'm sure it's going to depend like what situation you're going through, but is there
Mhm.
like a range of how many times you should be doing this, or like so many over some certain period of time? Like, what's the recommendation? I know from a kind of broader viewpoint.
Well, this is the response that is it depends. It depends on the situation. So if it's just like a normal person that's healthy, they can come and get it once a month. It's kind of like getting a facial, you just do a deep cleanse in your body. But for somebody who's had like post-surgery, like plastic surgery, liposuction, let's say, it's something that they're going to need every single day for like the first week, for sure. And that's like a huge discrepancy in the plastic surgery world because some surgeons tell their clients, that they need surgery the day right after, and some surgeons tell their patients that they don't even need any aftercare. So the, you know, like there's no protocol. So there's like a huge indiscrepancy. There's no protocol, there's no manual on post-surgery recovery. So I've gotten, patients who have come in 3 months post-op and they start getting seromas, they start getting fibrosis because they were kind of like left, alone and without guidance. So yeah, for anybody who gets any plastic surgery, planning to get any liposuction, yeah, it's totally recommended. It's something they should look into, talk to their surgeon, and do their research because yeah, a lot of people are not getting the proper treatment, not getting the proper care. And it's sad. It's pretty difficult to, heal on your own. Surgery itself is, scary as it is.
Yeah.
Yeah.
Okay. And so when it comes to this post-surgery recovery, you mentioned some things that could potentially happen, but I want to dive a little bit deeper into and make it a little bit more easy to understand. Like if someone has surgery and then they don't do any type of lymphatic treatment, what's the potential complications that can happen? Is it just that their recovery is slower, or can they actually develop more serious complications just because the recovery wasn't done right?
Yeah, so for let's say somebody who does have surgery and they don't get any treatments, their recovery is going to be a lot slower because there's nothing activating your body to flush out all that extra fluid that your body's building up. So one, your recovery is going to be slower. Two, you're going to have a poor quality of healing, and you're going to be, facing potentially getting seromas, which are pockets of fluid, and that, can turn into an infection. Also, they start to get fibrosis, which is, hardening of the skin and scar tissue, which is more difficult and, more cost effective to get rid of, which, it's kind of contradicts their whole investment of getting the plastic surgery in the first place. So then they start, they lose that investment that they made on themselves.
Okay. So when they do
Mhm.
the actual plastic surgery, let's just say that they're doing it on the face. So all these things that can happen afterwards, are those just localized to the face, like any complications or any slow healing, or can it also affect other parts of the body if they don't do this lymphatic treatment?
No, that would just strictly affect their face because, all the swelling and all the healing is happening locally in their face. So let's say they got liposuction to their chin, yeah, they would have a lot of swelling there, and if they didn't treat it, that they run the risk of getting fibrosis in that area. And I mean, yeah, that's painful and pretty expensive too. They have to invest more on other treatments if they don't get their lymphatic massages right after that.
Okay. And
Mhm.
when it comes to the lymphatic massage, are there certain areas of surgery, like on the face or like liposuction or on arms? Does the areas matter, whereas lymphatic treatment can be beneficial? Like if they get something on their face or their arms or their legs or their stomach, it doesn't matter. Lymphatic treatment can help them regardless, or is it really going to be a good treatment for only specific, I guess, surgeries you can call them?
Yeah, I mean, it's gonna be effective regardless, but with the areas that they got treated, for sure, it's going to be a dramatic change. It's going to be a faster recovery. Usually, it takes on a normal person, healthy person, it takes, like 6 weeks for them to get rid of all the swelling. But with the lymphatic massages, when they start with the lymphatic massages, you can start seeing all the swelling reduction within like a matter of 2 weeks. So it's a lot faster, and yeah, it's going to be more effective in those areas that they get surgery on.
Oh, wow. So even within potentially a third of the time, you can heal in a third of the time if you get this treatment.
Oh yeah, yeah, definitely. And then you're in less pain. And one thing that I've noticed is patients who get the surgeries, and if they don't get after treatment, after post recovery care, it takes them a lot longer to like even start driving, like up to 2 months. Um, and when we start the lymphatic massages, like right after the surgery, they're literally independent and driving. within 2 weeks, and they're more mobile. They're, back to their normal, routine. It's such a big difference. I mean, it's something, like I said, it's underrated. People are not really aware what to do after they get surgery. Um, but I mean, it's super effective.
Okay. And is there a difference between men and women with this treatment, or doesn't matter? It's gonna be the same for both.
No, it's completely the same for both. It benefits both. Yeah, we also get a lot of men who, go through surgeries, or even people who are just in wellness and they're changing their life. They've lost a lot of weight, and they're doing a lifestyle change. They'll come in on a regular basis to get these lymphatic massages, and it helps them a lot with, weight loss, because our body will hold a lot of toxins from the environment, pollution, just things that sink into our skin. And sometimes they, prevent us from losing weight. And we get, a lot of people who are in wellness and, in their fitness journey, that are coming in for these lymphatic massages. So it makes a huge difference. It boosts your energy, and it's just keeping you more, detoxified.
Okay. So detoxification is one big benefit of
It's
the.
huge, yeah.
Okay, got it. So, and even weight loss to a certain extent.
Hmm.
Okay, got it. Now I'm curious, I'm sure you've had a lot of people come in and they just don't really understand what lymphatic treatment, lymphatic massage really does for them. What would you say some of the most common misconceptions or myths that you hear from your patients about this treatment?
Oh man, like one of the biggest ones, people are afraid because they've heard that they're painful.
Hmm.
So, yeah, I don't know where they're getting these myths from, but they're not painful at all. And it's sad because a lot of these girls, they tell me that they didn't get any lymphatic treatments after the surgery because they heard that they were painful. And so they live on with agony, healing, poorly alone, because, they had that misconception that they were painful. But they're, like I said, they're really relaxing. We actually also do them on pregnant women, just because, when the woman is pregnant, they get a lot of swelling on their legs, and, on their hands. And so, yeah, it's very, very helpful to them because it detoxifies them, it helps them feel lighter, and, it helps them remove all that swelling and all that heaviness on their feet. Very relaxing.
Yeah, maybe it's the name because when I think lymphatic drainage, if I didn't know anything about it, I'm thinking, okay, you're gonna cut me open somewhere, stick a tube in, and drain something out of my body, like
Yeah.
all the toxins or whatever the bad stuff is, and then you're gonna have to pump me up with some other liquid and kind of flush it out. Like that's why I think about lymphatic drainage. But when
Yeah,
you call
no,
it lymphatic
no.
massage, I'm like, oh, that sounds not painful. That sounds relaxing. So maybe it's just the naming of it. They should call it lymphatic massage instead of lymphatic drainage.
Yeah,
Help.
true. Yeah, but the thing is, it's because it's not really like a massage. It's more, it's just like I said, it's a technique. It's more of like stretching on the skin. A massage is more like deeper, it's more muscular, and lymphatic drainage is just really superficial. It's very light.
Mhm.
It's, pulling on the skin, stretching the skin in different directions to guide all that lymph fluid to drain, because honestly, our lymphatic system is literally right underneath our skin. So it doesn't take a lot of pressure to move it around and redirect it.
Okay, so it sounds like it's so relaxing that have people
Is
ever fallen asleep when you're doing this on them?
Yes, I have. It's super relaxing.
Okay.
It's just one of those things that you just, you're falling asleep and you don't want it to end. And yeah, I strongly recommend it to anybody who's suffering with allergies, congestion, any of that.
Okay. I guess that's going to completely dispel the myth. It's so painless you can actually fall asleep when you're getting it.
Yes. Yes, definitely, for sure.
Okay, good to know. So I'm curious because when it comes to this type of treatment, you said there's a certain technique to it. So how can the average consumer, if they're looking for this, figure out who's really good, who really has this technique, and who they should go to? Like, what's the most important piece of advice you can give to someone who's looking and is trying to find that good provider who offers this treatment?
Well, this technique is offered only by it's either a physical therapist, occupational therapist, nurses, or massage therapists.
Mm.
So for physical therapists, they can always go online for the physical therapy website and research, on their MLD certified therapist, or even just the Lymphedema Academy website. You can just, search like the state of Texas, and it will give you a whole list in each city of, therapists that are MLD certified. So, for instance, if you're a person that's suffering from fibromyalgia, I know fibromyalgia helps a lot of patients, with MLD. You can just go on the Lymphatic Academy website and search for Find My Therapist, locally, to see, who you can find in that area.
Okay, good to know. Now, when it
Mhm.
comes to the treatments that you provide, I'm curious, how important is creativity in your approach to your patient care? Because I'd imagine if it's a technique, it's you pretty much want to keep doing the same technique over and over and over again. But also on the other side of that, everyone has a unique situation. So how
Yeah.
important is creativity in what you do and the type of treatments that you provide?
So it just depends on per patient, of course. I mean, some of them don't need full body. Some of them are like suffering from certain things. For instance, somebody might come to me that has, mastectomy, which is the removal of your lymph nodes after, you're going through cancer and chemo. So that approach would be different than somebody that's just coming in for a regular lymphatic massage. um, because you would focus on, more of their upper body. You spend more time on there. Some patients, are completely relaxed laying down, and some patients don't have that, that quality that they can lay down because, they're going through some surgery. They can't lay down on their stomach or on their backs. So you kind of have to like improvise, how you're gonna approach it. And yeah, it does vary on person to person. But the technique is pretty much the same, but it's just the only thing that changes is the diagnosis and their positioning.
Okay. And is there, I'm trying to think through it, is there maybe a story that comes to mind or a patient that comes to mind that was just really tough or challenging case and what you're able to do for them and get them a good outcome in the end? Is there maybe one story that you're able to share that just comes to mind?
Yeah, one of them always comes to mind, and this was probably a patient from like maybe 5 years ago that she was, I want to say like an 80-year-old woman, and she was in severe pain, and all her arm was swollen. One of them was skinny, the other one was really heavy and swollen. And I guess she had gone through breast cancer, many years ago, and she had her lymph nodes from her armpits removed. And because of that, she had lymphedema, like everything was backed up. And the thing with lymph fluid, when it has nowhere to go, it literally has like nowhere to go. It builds and it builds to the point where it starts to sink through your pores. And she was super swollen, arm and her whole torso. And it was very, very sad because she was just miserable, and she had told me that she didn't want to live anymore. And I did some lymphatic treatment on her, and I can't believe that nobody had offered it to her. She had, for years, it had been accumulating, and it was just, so life-changing for her. Something so simple, something so manual. It's just because people don't have that awareness, like sometimes, like I said, surgeons don't even tell you or tell the person, direct them to what they need. They just do the surgeries, they cut, and they move on, through to the next patient. And these patients are left alone having to figure out what to do. So thankfully, this woman was in therapy. She was there in the hospital for specifically for rehab. And I happened to know lymphatic, and I helped her with it was, yeah, it was super gratifying to me to be able, to help her.
Yeah, I can imagine. I mean, something
Mm-hmm.
going through a situation like that, and then being able to help alleviate all that pain for her.
Yeah.
And when it
Mm-hmm.
comes to, because that was one thing that in the introduction, was talking about how you work with breast cancer or also within that field. So, and I guess that was going to be my question as far as, as I find it hard to make the connection of lymphatic massage and breast cancer, but I guess it comes to they have to remove their lymph nodes
Lymph nodes.
or the cancer treatment, and that's what leads to that issue. Is that correct? Like that's the most common issue?
Yeah, yeah. So then they have to get, because we have a lot of lymph nodes in that area, like in this area. And so not all the lymph nodes get removed. Luckily they leave some there. But the thing is that some of them have to go through radiation, and the radiation is also killing, your lymph nodes. They're damaging them, leaving them more weak. So depending on the person, depending on their situation, that's gonna have, the effect on how much your body can drain on its own. So yeah, every case is different. Everyone is different. Um, but for sure, there needs to be more education on behalf of the surgeons as well, like guiding these patients to come and get these treatments.
Okay. And then also another question I had as far as because the name drainage, like lymphatic drainage, draining it out. So I'm curious, like when you're doing this technique, because since you're not injecting anything, you're not breaking the skin, it's really more of kind of like a massage. But where does the toxin go? Is it more just when you do this technique, it's stimulating your own body's response to kind of flush the system out, or is it something where you're like breaking up something by this technique, and then once it's broken up, it'll just get picked up by your circulatory system and flushed out when you use the bathroom or something like that?
Yeah, so what we do is we activate your lymphatic system. Our lymphatic system is already working on its own 24/7. It's already draining 2 to 4 liters of fluid, per day. But when we activate it, we're kind of speeding it up to pump faster. So you're draining a lot more. A person can drain up to like 20 liters of fluid per day in 24 hours. So that's what we're doing. We're directing it, we're speeding it up. And so then your body is eliminating everything, when you're voiding everything out.
Okay, got it.
Mhm.
Now, Linda, where do you think the future of this type of treatment is going? Like, do you think that there's gonna be a lot of changes? You think it's kind of been, it's always been around, and then it's just a matter of getting it
Yeah,
out? Like, where do you think the future's going?
I mean, this is something that has been around since, like, I want to say, since the 80s.
Hmm.
It's gotten more popular. I think it's something that is holistic, and people are always looking for holistic, uh, approaches. So I don't think this is ever gonna die out. I think it's only gonna just keep growing. From what I've seen in my area, there's people getting surgery left and right. I live in a border town. People coming in from, Mexico as well to get their surgeries, and the demand is high. There's the demand is high with plastic surgeries, with the amount of cancers that are, growing each year. It's the demand is high, so we really need more lymphatic therapists. It's only going to grow bigger, and it's a huge demand. So anybody who's a therapist and or an RN, I do recommend for them to look in that direction, in that field, and because there's not enough there's not enough therapists out there.
Okay. And for your business, the body sculpting room, what is your vision for your practice?
So, I mean, we do want to expand. We're actually working on that right now. We are working on a bigger location so we can hire more staff. And obviously, we're moving to Dallas as well. We're opening up another location where, because there's a lot of surgeries over there, a lot of plastic surgeons, and like I said, we want to close that gap and educate people that they need this treatment right after their plastic surgery. And so our plan is to just, keep moving more north, and eventually we can probably expand to other states as well.
So it's a bright looking future for the business.
Yes, for sure. Definitely. Hopefully, God is good. God has been blessing us, with, how far we've gotten and directing us. So, yeah.
Okay, awesome. Well, Linda, I have one last question for you, but before I ask it, I do want to point people to your website at bodysculptingroom.com. Now,
Yes.
my last question
Thank
for
you.
you is, what does beauty mean to you?
Beauty means, just being satisfied with who and how you are, embrace yourself. Because I mean, a lot of people turn to plastic surgery, and I mean, nobody is actually ever 100% happy. So you have to love yourself. You have to have the confidence. You have to embrace every curve, every imperfection. And that is true beauty. It just reflects when your confidence reflects and shines.
Awesome. Great answer. Well,
Mm-hmm.
Linda, thank you for sharing. Where can people contact you in your practice?
They can call me to my phone number, which is 956-855-7515, or they can go ahead and log into our website, which was www.bodysculptingroom.com. They can reach us there and, book an appointment, book a consultation, or, if they're interested in joining our team, we're always, looking for talent.
Awesome. Well, Linda, this was great. This is amazing. Thank you for coming on, sharing all about what you do and what you know, and hopefully this picks up more and more and more so we can help more people.
Thank you so much for having me, and God bless you guys for creating this platform for us to educate the public.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.